Coming to the next question, identify the age of the child. They had given the wrist x-rays and they had asked you to identify the age of the child. Now there are a lot of debates how to pick this up, but this is what most of the people say, that they could see about 5 to 6 carpal bones. Now I will give you a simple way to remember. Now you will always look at different ages at which these carpal bones arrive. So if I look at the proximal row, scaphoid, lunate and triquetral and pisiform. If I look at the proximal low, so scaphoid, lunate, triquetral and pisiform, these are the 4 bones and they have a simple mnemonic. She looks too pretty. So she looks what? Too pretty. So if you total these 3, right? So this is how it goes, like this, pretty. So total of this row is pisiform 12 years. So if you see the pisiform, then the age is going to be 12 years. This is the last carpal bone to ossify. So, and the second one, which is the distal row, is try to catch her. So when you go to try to catch her, trapezium and trapezoid, they go the same age as scaphoid. So it's again 5 and 5. And then capitate and hamate is 1 year age. And the total of this row is also equal to 12 years. So this is how we remember. She looks too what? Pretty. So 5, 4 and 3 is 12. Total is equal to 12 for pisiform. Try to focus on she. So trapezium and trapezoid, they focus on she. So again 5 years. And catch her. Why? Because she is pretty. So total is P, again 12 years. Now if you look at this question, if you have about 4 to 5 bones, it means that you have at least one of the scaphoid, the trapezium or trapezoid. So you have a bone which is at least 5 years, and everybody remembers that they had shown the scaphoid. So since the scaphoid was being shown there, it means that the minimum age has to be 5. So it goes away, 4 goes away. And it's also seen there was nothing called as a pisiform there, so it cannot be 13 years. So you have to choose between 7 and 10, and if you have got about 5 or 6 carpal bones, then the best answer to choose is 7 years of age. Remember 5, 4, 3, 12, 5, 5, 1, 1. And also remember scaphoid, if you can see, it resembles like 5. So the age has to be more than 4 and please up to 7. Between 7 and 10, 7 is a better answer. So she looks too pretty, try to catch her. Question number 8. Now they had shown a flexed elbow where they had shown a swelling over this area of the arm. This is called the pop eye, which is compared to the characters in the cartoon, the pop eye or the bicipital rupture. And this is how the tendon accumulates in the middle of the arm, called as the pop eye appearance. This is seen in bicipital tendon rupture. And then involvement of proximal interphalangeal joint, distal interphalangeal joint and first carpometacarpal joint with sparing of MCP. So remember this classical photograph that I have always been telling in all the lectures in detail. So this is how it goes. When you point your fingers towards somebody, the 2 joints that points towards him are classically involved in OA, because that's how you say OA. And when you say OA, so the 2 joints which are towards him are involved in OA, which involves DIP and PIP. And when you say RA, calling towards you, then PIP and MCP are involved in RA, means meri taraf aa, come towards me. So OA and RA. So DIP and PIP are involved in OA, PIP and MCP are involved in RA. We also remember classically that DIP is spared in RA, right? Relatively spared in RA. And the reason we always can remember, because females have to apply nail polish. And for having a good look of nail polish, the DIP should be very fantastic. So that's why how you remember that DIP is spared in RA and MCP, metacarpophalangeal joint, is spared in osteoarthritis because they involve DIP and PIP. Coming to the base of thumb, that is first carpometacarpal joint, it's classically involved in OA. And then the wrist joint, which is again covered by bangles, is involved in RA, the females. RA is usually more common in females. That's how it goes. Right? So OA, RA, first carpometacarpal joint is OA and the wrist joint is RA. That's how it goes. So here the answer was OA. Psoriasis will classically involve the distal interphalangeal joint, and RA will involve the PIP and MCP in this order, which is very, very important, along with the involvement of wrist joint. This is a classical example that should come to you. And look at what the same topic absolutely asks you one more question. A female presents with pain and swelling of the multiple peripheral small joints. The moment you see this line, your mind should run in only one direction, RA, and they have classically shown a deformity where there is a flexion of DIP and hyperextension of MCP, a PIP. This is classically called as a swan neck deformity, and the opposite of it is called as the Boutonniere deformity. This is rheumatoid arthritis. One question one should never miss. And then comes the last question, hyperextension of MCP and flexion and interphalangeal joint. If this is lost, right, or this movement is achieved by what? So they are basically talking about something called as a claw hand, and they want to speak about the movement. So this is what you should remember. Tuk. This is what Kapil Sharma taught us. Tuk. Babaji ka Tullu is a sign of action of lumbricals. It makes a L in your hand, and it is flexion of metacarpopharyngeal joint and extension of interphalangeal joint. So this is, if this is lost, if this lumbrical movement is lost, it leads to claw hand, and this is what is related to the lumbricals, which one should remember. So this is a action of lumbricals, this is paralysis, and this is correction of the deformity, for which you use a splint called as knuckle bender splint. Coming to question number 12. A child brought to emergency with multiple injuries, which included a femur fracture as well. He was confused with dyspnea and rash over the body. What is the diagnosis? Now the catch in this question was that the child presented 12 hours after the injury. He had confusion, means cerebral depression, dyspnea, and some say the saturation was depressed. Even after giving oxygen, he was not improving, and there was rash. Let's have a look at the options which are there. DIC is unlikely to present in this subtle way. It will be more aggressive presentation. Pulmonary embolism can be a possibility, but then we have a case of femur fracture, where if we have to think about embolic phenomena, instead of air embolism and pulmonary embolism, we will choose fat embolism. Now, this is the catch. Normally, fat embolism is not diagnosed in 48 hours and never in 24 hours. But here, the question is a variant. This is a rare example, but yes, if they do give you such a scenario with these explanations, the answer is going to be fat embolism. So this is all about NEET 2020, and we are happy that the questions that came this time were classical. They were from the relevant and important topics. They were around 5 to 6 images, and they were all related to what you have been normally seeing in the wards. This is a great hint for the future exams that will come at all India basis. They will be more of clinical, they will be integrated with applied anatomy, and similarly there was one more question this time which asked about the costochondral joints, what kind of joint it is. So these are the questions which you will have, and then the linking of these joints with the different diseases that you will have, and that is how one should remember to prepare. Try to go integrated with different subjects, and all the best, dear friends. If you have any feedback, do let me know. Thank you very much.